Welcome to HealthFirst Top Doctors podcast. Today we're discussing long hair transplant with leading hair transplant surgeon in London, Dr. Eleojo Achimugu. How are you, Dr. Eleojo?
Hi, I'm really well, thank you. Thank you for having me.
Not a problem. It's really nice to have you today. Really nice to speak to you. And could you tell us a little bit more about yourself and your work?
Of course. So as you said already, my name's Eleojo Achimugu. I'm a hair restoration surgeon and a pediatric surgeon. I'm based in London at the May Clinic, on Harley Street. I have been in the hair restoration world for quite a few years. In fact, I think this is the beginning of my 10th year, something like that. Maybe we shouldn't count. Um, but I'm particularly passionate about doing hair transplant surgery using a small needle technique in all hair types.
Fantastic. Well, let's get started with the questions.
Hmm.
What is long hair transplant, and why would somebody want to go through that? Why would they want that?
So that's a great question. So, a hair transplant essentially involves moving hair-bearing tissue from one site of the body where you have plenty of hair to a site where you desire hair. So, it might be a thinning area or a completely bald region. So, typically, you'll find that the routine approach involves shaving the area where you're taking hair from. And if we're taking hair from the scalp, we typically take it from the back and the sides of the head. That area is shaved down and the tissue is harvested. When we harvest, a doctor will remove groups of hairs. So we refer to that as follicular units. And so we safely move that from that site in the back to the front, for example, and implant that follicular unit in the side. So what you have is, be it a man and a woman or a woman, the area that we take it from will be shaved. However, if you're doing long hair, no shave, sometimes referred to as a preview hair transplant, it has the advantage of not shaving the donor site, so that it minimizes the surgical footprint. And long hair is moved from the back to the new site. And so you can imagine that in a woman, for example, or someone with Afro textured hair like my own, especially in women, not just women, but anyone who doesn't want to shave and wait the 1 centimeter a month hair regrowth would probably prefer to use that method.
Yeah, absolutely.
Yeah. And I was going to say, like, the other potential advantage of this technique is the fact that it gives you a preview, hence the name, gives you an idea of what the fullness will look like at the end, but from the very beginning. I especially like using it when I'm doing eyebrow hair transplants because you can see the angle of the hair again from the get-go, from the moment you implant it. You're not waiting 6 months or 9 months to begin to see growth.
Fantastic. Well, you kind of alluded to it just then, but how effective is long hair transplant?
Again, I think that's a really good question because what I say to people is, if your scalp is healthy and we're moving healthy hair bearing tissue from a healthy site to a healthy new location, I expect the hair transplant to work. So, whether the hair attached to it is long or short, so short if it's shaved or long if it's unshaved, I expect that to work. So, the length of the hair doesn't make that much of a difference, if that makes sense, from the effectiveness of the growth, because your body is doing that regrowth. However, the extra care comes in the management after the treatment. Um, Hair is as strong as rope. Do you know the times? I think there's a story where hair tied together is being used to pull a ship. Um, Across in the ocean. I believe the story. But like, the hair is really strong. My point here is actually what I'd expect from my patients after the procedure is to be extra careful after long hair, no shave, not to start playing with the hair too easily in the first 2 weeks. You want to allow the body to do the healing, and then the hair to begin to grow once it's reconnected to the new underlying tissue.
Fantastic. So, is it advisable to take some downtime after the procedure? And how long does it take for the results of long hair transplant to show?
Yeah, so this is where actually it's quite interesting in that you see for long hair, no shave, you see the likely, well, you see the results. You get a preview of what it'll look like when your hair is long. Now, what every patient needs to bear in mind, and any surgeon who takes this up also, is that the hair may still shed. Every time after a hair transplant, short, long, unshaved, what you find is that between weeks 2 and 8 after the procedure, you may shed existing hairs. Yeah. And this includes from the transplanted hairs, not just that area. Now, should that happen, it's the patient wait for from 3 months, but I tend to tell people 6 months so that we're not worried before that time. So 6 months to 9 months to begin to see regrowth and to appreciate the fullness of the results one's expecting to have. So does it work? It does work. How long will it take to see the results? Actually, the advantage of long hair, no shave is you get a preview. And in some people, they don't shed. So you have the fullness from from the get-go. At the May Clinic, what we do is for every form of hair transplant, there's a complementary regenerative procedure added to it. And we do that with the hopes of just optimizing the results and trying to minimize the risk of shading. There's no shedding, no shading, shedding, but there's no guarantee. But we know that it helps in the recovery and boosts the results of the procedure.
Yeah, absolutely. I think these kinds of procedures it really would help to know that I'll feel more confident um knowing that something was about to come, and that sounds like a really useful way to go about it. Absolutely.
Yeah, and for sure. And also, I know I haven't quite answered your question. I'll come back to that. But it's also thinking actually for client-facing patients. So if you're on TV, for example, it doesn't have to be TV. If you've got a big conference coming up and you're asking about the downtime, the potential advantage of long hair, no shave is it's less obvious that something's being done because you don't have stubble in the new site. You have long hair sitting in the new site or longer hair. Now, the downtime after a hair transplant procedure, whatever the procedure, actually, thankfully, it's really a few days. But because as the body heals, it can form scabs around the individual little incisions that we've made, both in the donor region and in the recipient area. So the recipient area is the site where we've implanted the new hairs. And that the scabbing may occur between day 7 and 10. So some of my patients prefer to be away from people for those 10 days, so the first 2 weeks. Um, and that applies to both the long hair and the short hair. But I'm finding that the scabbing is less obvious in long hair, no shave. But I think it's because the hair camouflages it. So again, it's a potential advantage, but people have a choice.
Yeah, absolutely.
Mm,
It's good to know.
mm.
So, what are the risks of long hair transplant?
Yeah. So what I'd say is actually the risk with any hair transplant, which is it. So it's surgery. However, some people refer to it as minor surgery. It is still surgery. And so we minimize risk by choosing a reputable surgeon, choosing a reputable clinic. And we as a team make sure that we identify the right patient, the right procedure for the right patients. It really isn't a one size fits all. So risks include a small risk of bleeding, but again, with a good medical consultation with your doctor, the person who's about to do your operation, that those sort of things would be looked at and and addressed. So your medical history, your previous surgical history will be or should be reviewed by the team operating on you. Now, so small risk of bleeding, tiny risk of infection. We don't tend to use antibiotics because, as you know, there's a world issue with antibiotics. So we use it judiciously. Should someone develop an infection, then it's manageable. Cosmetic dissatisfaction has to be stated. So again, this is where a good understanding of what the patient desires and a written documentation of what they're aiming for, and then good counseling to help understand what is achievable with your existing hair loss, what we're doing to prevent further hair loss, and then the hair transplant to add to your existing hairs. So I know I've gone a roundabout way of saying this, but the risks for hair transplant surgery, thankfully, it's minimal if the basic steps are done correctly. We have heard in this year, unfortunately, of sad cases abroad, but relating to British patients. And in the end, this is where that surgery involves the use of anesthesia. Our patients are awake. It's under local anesthetic, but that also carries some risks. So again, you want to be seeing a doctor when you're having your assessment for this procedure, and you want to be seeing a doctor, the same doctor that will be doing your operation. So there are small risks associated with a hair transplant, but it's manageable. Now, with long hair, no shave specifically, all the basic rules for preparation for a hair transplant come in. You've probably heard me say over and over again before, correct the correctables first. And that includes, patient associated risks, as well as hair loss associated things. Those need to be corrected. With long hair, no shave specifically, it's been aware that the hair may shed after implantation. And like a shaven approach, you may shed between weeks 2 and 8. There's steps we're taking to minimize that, to help minimize that, but it's not guaranteed. But that being said, at least you don't have the evidence of having shaved. So it's a more cosmetically, it's a better camouflage. So again, one of the things I love is when people have an operation with me, when they come back and say, no one knew I had the operation, but they know my hair's better and they keep asking what I've done. So that's the sort of thing. And that's why I'm passionate about long hair, no shave,
Yeah,
because
absolutely.
it adds to it.
I know somebody that did go through not a long hair transplant, but a hair transplant, and there was a not significant amount of recovery, but
Mhm.
was impossible for them to be out in public like immediately. So you
Mm,
sounds like a really, really useful
option.
way, absolutely.
Hmm.
Okay, great. And so the final question, what does a long hair transplant do for patient confidence, and their general quality of life?
Do you know, hair restoration, it's just such a privilege to be in this field. And just today, I had a letter from a patient who had a hair transplant 2 years ago, thanking me, stating specifically how her confidence has grown. Um, and I was so moved by that. I think sometimes we crack on with what we're doing, with the surgery, with the work, because life gets busy. But it's so enriching to know that you've helped to build someone's confidence, helped to boost them um, to remember who they are or who they felt they'd lost because their hair has changed. So obviously hair loss and the management of it is complex, but it just feels like such an honor, a privilege for someone to ask me to journey with them. And it's rewarding when you see the impact you have. And this is a lady who's an older lady, but it's just so nice to see that. And I also see it in like my younger patients, young male patients who maybe weren't able to go out before, weren't confident to step out without a hat. and now they walk into clinic, their stance, the way they carry themselves is so different. So I think, unfortunately, over many, many years, we've all, to a degree, underestimated the impact of hair, the and what hair may reveal about what's going on within a person, and also the potential cultural impacts of hair. Do you know? So, oh gosh, it just feels, I don't know how best to answer that question, but to say it's such a privilege to know that, in a way, we're helping people on a journey towards positivity.
Fantastic. That's amazing.
Mm.
Okay, well, that's it for today. Thank you so much for joining us. We really appreciate it.
Thank you again for having me. It's been a pleasure.
No problem at all, Dr. Eleojo. If you're interested in long hair transplant, arrange a consultation with Dr. Achimugu via her profile at topdoctors.co.uk.